we start treating the patient with epilepsy, we're starting with a single medicine, and our goal is to get the patient seizure-free and no side effects. So in a fair number of patients, we can achieve that with our first choice based on knowing what we know about their seizure type and kind of our medication choices. For some patients, we'll have to change medicines a couple times, see if we can get there. If we can't, and we're down the road, some clinicians, it's 2, 3, 4 medicines, then based on what our evaluation has shown us as far as the cause of the patient's seizures, other factors may go into it as well, other comorbidities they may have. Is this person had a head injury with seizures? Do they have cerebral palsy? What else is tied in? Then we'll start to talk to patients and their families about other choices. And there's kind of 4 big categories. So we always have other medications. There's lots of those and new ones all the time, which is great. It gives our patients more hope. We have more options. We have devices that are used, and we have several of those now that may be candidates for. Epilepsy surgery is an option. And then we have dietary for select individuals that may help. And then we may even combine some of those. But the key is once they haven't responded to medication is kind of say, okay, how do we sequence you? Let's look at these options. We may have to do more diagnostic testing, and let's figure out a pathway for you to get your seizures doing better and maximize your quality of life. So one of the goals, in treating any chronic illness, and especially epilepsy, where the risk is so high. If I'm treating, my seasonal allergies and I forget to take my antihistamine, I might sneeze more, but the risk is not so high. If I have seizure medicine I'm supposed to take every day and I forget a couple of days, then it's high risk. If I have a seizure while I'm driving or while I'm at work, it's a whole different risk factor. So for our patients, it's critical that they stick with their medication schedule and regimen, that there is, we'd like them to be 100% adherent all the time or as close to it as possible. So we really have to give our patients strategies, one, to make sure they understand the importance of it compared to any other problem they might be treating with medicines at home, and then give them strategies to kind of help them achieve that, because none of us are perfect. We all forget things. So how do we do that? So, and there's a host we try and tailor to our patients. So if we can make the medicine regimen simpler, if we can do once a day dosing, even 1 pill once a day, that's easier to remember. So we could do that. If they're late for a pill, or by late, if they're taking it in the morning and it's lunch and they haven't taken it, if we can give them strategies of what's appropriate to make that up instead of just missing it and starting back the next day, that helps our patients. Do you set an alarm on your cell phone? I mean, we just try and tailor it to what our patients are doing and really make sure they have a strategy. And then in my clinic, when we see them back for follow-up, we ask them, did you use the strategy since we last saw you? Because patients hate to tell their doctors that, oh, I missed some medicine. But if you say, did you use the strategy? And they say yes, then you kind of know, and you can have a nice, calm discussion without there being any, pejorative attitude. I'm not blaming them for missing medicine. I'm not, the bad guy, kind of thing. And so it just makes it a lot easier because then we're on the same team. We're just trying to get them to have the best possible seizure control they can.